This is Tom Biernacki, and today I'm going over the 9 best supplements and vitamins that you can take for your joints. So we're not talking about pills and medicines, and I'm going to give you the big tip that makes it all work at the very end. So stick around till the very end. We're starting now. So osteoarthritis is a little bit different than a couple other forms of arthritis because you have like gout, you have rheumatoid arthritis, you have psoriatic arthritis. Osteoarthritis is the damage of cartilage, but this is not just due to body weight. And there are lots of different types of arthritis. Osteoarthritis is basically when your joints rub and they unevenly load and the cartilage can wear away from these joints. And what happens is these supplements we want to use to take the pain level down. There's knee pain, there's hip pain, there's shoulder pain, and me as a foot doctor, I deal with a lot of foot pain. The beauty is there's a lot of these supplements, so we're going to go over the big tip that ties it all together at the end and make sure that all these things are effective. But first, let's talk about a couple pills. Tylenol and anti-inflammatory. Tylenol works more on your pain perception in your brain. It doesn't actually make the joint cool down. It doesn't fix any cartilage, and it's metabolized by your liver. There are some serious dangers to overdosing, and even though it can help you feel better, it doesn't necessarily help the joint. Number 2 is anti-inflammatories. So these are non-steroidal anti-inflammatory drugs. And the most common one is ibuprofen or Aleve. The big problem is you don't want to take these long-term, even though they do work well. I've seen people have to go on dialysis, have serious kidney problems. So there's huge problems taking too many of these pills. So I'm going to do a countdown of the 9 different supplements that you can take for your joint pain. And we're going to see how effective they are and how effective the studies say they are. So these ones are Boswellia, Devil's Claw, MSM. So those are 3 right there. There's such light studies that basically compared to a placebo, they're not that effective. There's always that placebo effect, like, hey, I took this my whole life. I always feel better when I take it, but there's no true real studies showing they're overly effective. Another one is, it's called SAME, but it's S-adenosyl L-methionine. Realistically, don't worry about taking this stuff. There's some studies, they're not great. There's also avocado soybean extract called ASU. So this is like an all-natural avocado soybean extract, but the levels are so low that realistically you could eat avocados and soybean till the end of your life. It doesn't build up towards meaningful levels. Not a great study. So let's get to some of the more serious ones. So chondroitin. So what happens is this is a building block of cartilage. And what happens is it's unclear exactly how these supplements work, but there are some studies that say that people that take chondroitin throughout their life, they do get some benefit, So are these great studies? Are these like overly convincing studies? They're not overly convincing. The next thing is, are they dangerous is the next big thing. Not overly dangerous. Unless you like go crazy, there's probably not much danger with these. So the studies do show that essentially taking 400 to 800 milligrams 2 to 3 times per day can be effective. This can cost you a little bit of money. It certainly wouldn't hurt overwhelmingly. And some studies do show that it can help a little bit, but it's unclear exactly how this happens. So next, in our countdown, we're going to number 3. So that's glucosamine. So glucosamine is also a building block of cartilage in your joints. How effective is glucosamine? Same thing as chondroitin. There's a little bit more studies to it. And what happens is there's no clear answer to how it works. But one study says glucosamine did provide some benefits. Another study might say that glucosamine doesn't provide any benefits. So the thing is, placebo is if you take a sugar pill. Does that sugar pill make you think you're feeling better? So a lot of times up to 40% of people can say yes. So compared to the placebo and double-blinded studies, chondroitin and glucosamine were not overwhelmingly certain that they did, even though some studies do show that they are effective. So it certainly won't hurt except your pocketbook, but can it help? It can potentially. There's new studies coming out every day, and I think some of them are showing it's working. Some of them show that it doesn't. The way they did these studies is they made people take chondroitin and glucosamine for 6 months. And they said
The majority had over 20% improvement. It's not huge, but it can help. I even had my mother take these and she said she liked them and it made some improvement. But we did all the other stuff that I'm going to tell you about later, and that probably contributed a whole lot more according to studies. But this stuff does not hurt if you can afford it, because it's probably not that dangerous just to your pocketbook.
Number 2 in our countdown is fish oils. I love fish oils. Fish oils are huge. This has so many benefits for fish oils. In Western society, these have gone up dramatically. So there's a study that shows essentially if you have a high ratio to omega-6 fatty acids, which are kind of the bad fat, to omega-3 fatty acids, which are kind of the good fats, which what they show is people who ate a lot of the bad fats, so a lot of vegetable oils and seed oils, if the ratio was like 20-1 of bad fats to good fats, people had a lot more inflammation, a lot more diseases. Whereas people who had omega-3 fat in a 1-to-1 ratio, they were a lot healthier, they were doing well. So this is like omega-3s come from like fish, like salmon, like nuts, like vegetables can have a lot of this. So the more you focus on that, the less inflammation you will have.
So omega-3 fatty acids usually come from fish, especially cold water fish like salmon, but it can also be converted from plants if you are a vegan. So a lot of plants can convert to it, but at a much lower ratio.
The downside is the proper fish oils can be expensive. So here's the trick. I went to a budget grocery store and I saw fish oils for a very low price, but I took a look at them and it had 1,200 milligrams of fat in there, and 200 of them were fish oil. So fish oil is DHA and EPA. So really you're getting about 200 milligrams out of 1,200 as fish oil. So really you're getting 1/6 of that being good oils. The downside with this is getting like 80% bad fat offset by getting 20% good fat. Probably not. And that's what studies show is you have to probably get something good, like something that's over 50% good fish oils. You don't want to be scarfing down bad fat and paying a lot of money for this stuff. So make sure that the ones you're getting are researched, and it's mostly DHA and EPA. Studies show that fish oil, when taken consistently, can be effective. So while there's no definitive studies for like certain joint osteoarthritis, it can be shown as an anti-inflammatory. There's a study with like rheumatoid arthritis that shows fish oils can be effective. They can also help with like weight loss. Fish oils, and probably this one, are the most effective. So turmeric. Inside turmeric, this is a spice, and the spice has 3% curcumin. So curcumin makes up the spice turmeric in the 3%, but the curcumin is what gives the anti-inflammatory effect. So eating the spice by itself, you'll probably need to eat it in extreme levels to build up the curcumin at that 3% level to a level that actually helps you. So supplements and capsules are available, and there are studies that show that it helps. So we have another video that goes over curcumin just by itself. Is it worth taking? And we link that down below. But the reality is some studies do show that it helps. It can help with anti-inflammatory joint pain in your knees, in your feet, in your ankles. And also it has a lot of other antioxidant, heart effects, brain effects, some Alzheimer's, So some people take this and they swear by it. Even in the comments in some of these videos, people are like, curcumin changed my life, or turmeric, I should say. But some of the studies aren't as definitive. Is it safe? The reality is it's a pretty safe medication. It's not the most expensive. It's a natural spice. So you can't really do a ton of damage unless maybe you went extreme and like choked on it, but the reality is it's safe and there's no downside trying this. It could be very effective, whereas anti-inflammatories could like give you kidney failure, or Tylenol could put you in the hospital if you overdose on that as well. So that's the real benefit. If you are desperate for joint pain relief, take it. It can work well. Here's what ties it all together. I see people in our clinic in Michigan all the time for joint pain. The reality is feet, knees, hips. Cartilage will never grow back. I don't think anybody's found a scientific way to grow cartilage back. Even the implants, even the $10,000 injections that some people are saying, there's nothing definitive. But the thing is, I have seen people all the time go from no pain to a lot of pain. Don't blame your cartilage for 100% of your pain. And listen, if you're like a 20-year-old athlete who had a break, that's a different story. What I'm talking about is more the seniors, like people over 50 whose knees and hips and feet are sore. So obviously I can't paint this like a brush, but I do a biomechanical analysis. So I check out people's backs, hips, knees, feet. The real trick is, are you aligned? Are muscles holding your joint properly with the proper shoes, the proper orthotics, the proper home slippers, the proper flexibility, the proper muscle strength? I've seen that make such a big difference that the person doesn't want surgery anymore, that they don't want injections anymore. And that's what makes a huge, huge difference. Now, granted, it could be like extreme osteoarthritis with like a jagged edge in the bone and the cartilage missing. But I've found, get evaluated by a biomechanical specialist, so an orthopedic doctor, physical medicine rehab, or a podiatrist like myself, if you're in the Michigan area, and fixing all those things. And we make a million videos about this. So if that worked for you, share this with your friends.